best is that we're not getting healthier. Why is that?
Christopher Duntsch is a young spine surgeon with a big salary and an ego to match. What I am being is what I am. A mother stone cold killer who will ruin or build whatever he wants.
Hey guys, it's me here, Lavender here, and today I am back. Crime case. Today I'm doing the true crime case of Dr. Death. So let's get started into this true crime case. So this true crime case was featured in a number of media and TV, such as this true crime case was featured in American Greed. It also was featured in a short series called Dr. Death on a Peacock streaming service. So let's get started into the background of this evil man, this evil doctor called Dr. Death. Christopher was born in Montana and spent most of his youth in Memphis, Tennessee. His father, Donald, was a physical therapist. Having exhausted his football career and eligibility, he decided to switch to a career in medicine. He completed his undergraduate degree in 1985 and then continued to an ambitious MD PhD program, and in 2010 he completed that program and neurosurgery residency programs at University of Tennessee Health and Science Center. He completed his residency having participated in fewer than 100 surgeries. Typically, neurosurgeons residents participate in over 1,000 surgeries in the course of their residency. He's suspected of having been under the influence and having a cocaine addiction while operating during his 4th year of residency training, and was sent to a program for impaired physicians and doctors. He remained there for several months before being allowed to return back to the residency. Several of his friends, his own friends, recalled him going to work after a night of doing drugs or drinking, with one of them saying he would never allow his friend to operate on him. While in Memphis, he began a long-term relationship with Wendy Renee Young. They have 2 sons together. Okay, now on to the events leading up to this true crime case and everything that occurred. So initially, Christopher focused heavily on the PhD half of his degree. He took part in a number of biotech startups. However, by the time he met Young, he was over $500,000 in debt. He decided to turn to neurosurgery so he can pay off his debts, which can be a lucrative field, and he can make money to pay off his debts. In 2010, he moved to Dallas with his wife and his family. Upon applying for work, he looked extremely qualified on paper. Christopher joined Baylor Regional Medical Center at Plano as a minimally invasive spine surgeon with a salary of $600,000 per year, plus bonuses on top of that. He had made a poor impression already on his fellow surgeons in the area. One of them recalled that Christopher frequently boasted about his abilities. They also recalled that Christopher's skills in the operating room left much to be desired, basically saying, as the person put it, Christopher could not wield a scalpel or use it correctly, basically saying he's not that great of a surgeon. He's like very basic. He's not that great at all. Like, he can improve. Just awful surgeon skills. Due to his drug use and lack of, neurosurgeon ability, he maimed a lot of his patients. Here are some, not all of his victims. Kenneth Fenanol was a first patient of the doctor, operated at Baylor Plano, and was left in chronic pain after the doctor operated on the wrong part of his neck due to the debilitating pain. Later had a second operation by the same doctor, this evil doctor, to relieve it, and was left significantly paralyzed in his legs. He required months of rehabilitation to be able to walk again with a cane, and was left unable to walk for more than 30 feet or stand up for more than a few minutes without having to sit back down again. Another victim was Barry Murdoff, owner of a pull service company, who was left with bone fragments in his spinal cord after the doctor tried to pull a damaged disc out of his back with a grabbing tool. The doctor initially refused to give the victim any pain medication, claiming the victim was a drug seeker and seeking drugs. The doctor eventually lost most of the victim eventually lost most of the function on his left side. Another victim was Jerry Summers, a longtime friend of the surgeon in question, who came to Plano to have 2 neck vertebrae fused. During this operation, he had botched the removal of the disc. Summers was rendered a quadriplegic, and the anesthesiologist who worked with the doctor on the surgery recalled that Summers lost almost 1,200 milliliters of blood, more than a fifth of his blood volume and almost 24 times the typical amount of blood loss in this typical spinal infusion. Summers remained a quadriplegic for the rest of his life, and he died in 2021 of an infection related to complications from his friend's deadly operation. Baylor Plano officials found that the doctor failed to meet their standards of care and permanently revoked his surgical privileges. The hospital initiated another peer review, but the doctor decided to resign rather than face certain termination and firing to avoid the cost of fighting and possibly losing a wrongful termination suit. Hospital officials reached a deal with him and his lawyers, in which he was allowed to resign in return for Baylor Plano issuing a letter stating there were no issues or problems with him. Had this evil man been fired, Baylor Plano would have been required to report him to the National Practitioner Data Bank, which is intended to flag problematic, bad, evil physicians and doctors, pharmacists, etc. Christopher then moved to Dallas Medical Center and Farmers Branch, where he was granted temporary privileges until hospital officials could obtain his records from Baylor Plano. However, red flags soon surfaced early on, as nurses wondered if the surgeon was under the influence of hardcore drugs and drinking while on duty. For example, he came to work wearing the same tattered scrubs for 3 days in a row. He never changed. He lasted for less than a week before administrators pulled his privileges after the death of a patient, Folita Brown, and the maiming of another, Mary Eford. He had severed Brown's vertebral artery and refused to abort the surgery despite the massive blood loss. He then packed it with too much of a substance intended to stop the bleeding. She suffered a stroke as a result of this. While operating on Mary, he severed one of her nerve roots during a spinal infusion surgery. Despite several warnings from his colleagues that he wasn't doing the surgery correctly, he didn't take a hint and kept trying to do the surgery even though he was failing at it and didn't know what he was doing. He persisted, resulting in this victim, Mary, was left paralyzed. She later recalled waking up feeling in excruciating pain. So people who were in the operating room with the doctor for surgery suspected that the doctor was under the influence and may have been intoxicated, saying that his pupils were dilated. He later moved on to other facilities, meeting more people. Jeff Glidewell was another victim. A sponge triggered a severe blood-borne infection caused by a botched surgery the doctor did. The victim in question would become septic from that. Well, when the doctors discovered the sponge, the doctor, Christopher, refused to return to help remove it. The victim was left with only one vocal cord, permanent damage to his esophagus, and partial paralysis on his left side. Someone claimed that it looked like as if Christopher the doctor had tried to decapitate the victim, and he was called a crazed surgeon, and that this surgery had been one of the worst botched surgeries ever seen, and this surgery should have never happened in the United States of America. It was never seen before. He later moved to Denver, Colorado, and went into a downward spiral from there. He declared bankruptcy after listing debts of over $1 million. And in March 2014, 3 former patients all filed separate federal lawsuits against Baylor Plano, alleging the hospital allowed him to perform surgeries despite knowing he was a dangerous doctor/physician. The suit also alleged that Baylor Plano made an average net profit of $65,000 on every spinal cord surgery performed by this crazed doctor. And in 2015, approximately a year and a half after his license was revoked, he was arrested in Dallas and charged with 6 felony counts of aggravated assault and other charges. And on February 20th, 2017, he was sentenced to life in prison. If you guys like this video, don't forget to comment, like, and subscribe. Bye guys, see you next video.